Thank you everyone for making the time to join. I know there's still some folks who may come in, but we can go ahead and get started. Today's webinar is focused on evaluation data collection. My name is Tanha Patel. I'm a senior technical advisor with the CDC Foundation, and I have with me Haley Case and Joy Henry, who are helping me behind the scenes run the slide deck, and you'll see Joy in the chat as well. As we get started, we just want to ask that you try and minimize distractions as much as possible. Feel free to ask questions as they come up in the Q&A feature of Zoom. You'll see the banner at the bottom for Q&A, and we've saved plenty of time at the end to answer your questions. So feel free to keep those questions coming, and we're happy to stay longer if needed to get to all the questions too. We will also share a copy of the slides with you and the recording. It will be saved on our website, and the link is in our chat. So feel free to go back on there in a couple of days, and you should have all of the webinars, the recordings, and the slides available for there. Today's webinar is the third webinar in our series, which is building on evaluation and introducing evaluation to the Perinatal Quality Collaboratives. The first webinar introduced what is evaluation, and then the second one we talked about how do you focus in and evaluate a quality improvement initiative that your PQC may be implementing. So just as a quick refresher, evaluation is an iterative, data-driven process to collect data to answer questions you may have to drive initiative improvement. A planned and purposeful evaluation helps inform decisions and provides a better understanding of what is expected of our initiatives and demonstrates if and to what extent the initiatives are functioning as intended. To conduct an evaluation, there are 4 general steps that you have to take. You have to define what you're evaluating and focus in on what exactly about the initiative you would like to evaluate at this time. Once you know that, you want to plan for and start getting data to build your evidence and evaluation findings. This is what we will focus on today, and then the next webinar in May will focus on how do you share and summarize the evaluation findings to use the evaluation findings in practice for initiative improvement and communicating value add. If you were able to attend our last webinar, you'll recognize this diagram of our fictional example PQC that has 3 different initiatives: a hypertension in pregnancy initiative, a substance use disorder initiative, and an obstetric hemorrhage initiative. If you were not able to attend the webinar last time, the recording is available on our website, and I'll encourage you to kind of listen in to that to see how we defined the initiatives and how did we focus in on the hypertension in pregnancy initiative as part of the focus that will carry on throughout the webinar series. So we talked about how evaluating all of our hypertension in pregnancy activities is not really realistic. And in the last webinar, we decided to focus our evaluation on the comprehensive care plan portion of the initiative. In that webinar, we also identified 2 key questions that will ground the evaluation. The questions are, to what extent are the hypertension care plan activities functioning as intended? And what are the barriers to adhering to care plans? A strong evaluation involves systematically answering your evaluation questions. So the rest of the webinar will try to capture that and systematically talk about how do we answer these 2 questions for our example. And again, if you want, you can review the recording of webinar 2 for detailed understanding on how we came to these decisions. But today, I'm going to carry forward these 2 questions, and then we'll build a data collection plan for those. To collect evaluation data for each evaluation question, you must first identify indicators for each evaluation question, and then choose a data source and data collection method that is most appropriate for each indicator that we have identified. Indicators are data points that provide information to answer an evaluation question. The indicators are tailored to your evaluation type and your initiative stage of development. We'll talk about this in a few minutes. But for now, for each evaluation question that you have, you should have no more than 3 to 5 indicators that will answer the question. It is possible that some questions will have different ways of answering the question, but you want to prioritize and focus on what's the most important thing for you to know at this time. As shown in the slide, if you have 3 evaluation questions, the list of indicators will get long, which will mean that you'll have to collect a lot of data to answer those questions and indicators. So try to focus on what's really important for you and what information do you need to answer the question in a way that it could be used. If the information will not be useful, then you can leave that information for another evaluation. Indicators can be quantitative or qualitative. Quantitative indicators are number-based data, such as counts, scales, or data characterized based on what is being measured. Common examples of these data are age, days, height in feet, amount in dollars, the number of births in a population. Quantitative indicators are often used to help answer questions such as who, what, when, and how many things are being responding. Examples of quantitative indicators are the number and percentage of prenatal patients who receive counseling on mental health. Another example is the average gestational age of newborns delivered at participating hospitals. On the other hand, qualitative indicators are textual data, such as answers to interview questions, or focus group conversations, or descriptions of something. Qualitative indicators can be used to answer questions like, what is the need? Why and why not should we do something? How or how not can we do something? Examples of qualitative indicators are patient perspectives on trauma-informed care provided, and types of facilitators for readiness to respond to obstructed hemorrhage events. Indicators can also be classified by the type of evaluation that they align with. For example, if you're doing a formative evaluation, you will use formative indicators to measure the need for the initiative and/or what is necessary to implement the initiative. These types of indicators help you understand what should be the design of your initiative. So for example, a formative indicator could be the needs of Hispanic pregnant people in the state, or best practices for implementing a perinatal mental health screening program, or number of full-time equivalent personnel per birthing site needed to implement a particular initiative. Measuring these indicators will help your team make decisions around what perinatal health need exists, how best to address the needs, and what resources will be needed. For a process evaluation, process indicators are used to measure how an initiative is being implemented and if and how the activities took place. Since a lot of the process evaluation is focused on implementation of the initiative, process indicators can be grouped in categories like implementation, reach, adoption, maintenance, and effectiveness. Implementation refers to how well activities are delivered compared to the plan and can be measured in many different ways. An example of an implementation indicator is adjustments made to guidelines to fit the need of a unit. Reach measures how many people or settings are reached by the initiative activities. An example is number of eligible individuals who actually end up participating in the initiative or in the training. Adoption, on the other hand, measures how many people or settings are actively willing to participate in the activities. So it really is talking about what is the uptake of the initiative. So an example indicator here is number and percentage of hospitals participating in the initiative. Maintenance, on the other hand, is the extent to which activities become embedded in a setting. An example being number of months the initiative is implemented, number of months the initiative stays on after it's been implemented. And effectiveness measures the extent to which activities work at achieving intended outcomes. An example of this is percentage of staff reporting increased knowledge around new guidelines for hypertension after they attended a training. And you'll notice that the effectiveness is now starting to look at your outputs and short-term outcomes of the activity. So it's really now starting to move towards outcome evaluation. So we do have outcome indicators, which are used for outcome or impact evaluation. Outcome indicators can measure the short-term, the mid-term, or the long-term outcomes, which are achieved by the initiatives. An example of a short or mid-term indicator is number of clinicians in the state using standardized cardiac risk assessment tools. This measures a behavior change that is expected to take place soon after the initiative activities are completed. An example of a longer-term outcome indicator is percentage of pregnant people in the state with serious complications due to cardiac conditions, and percentage of change in pregnancy-related deaths due to cardiac conditions among pregnant people in the state over 5 years. These longer-term outcomes, they measure an intended change in health outcomes that would be observed probably a long time after the implementation of the initiative takes place, because the health outcomes take a little bit longer to achieve. So as you start thinking about your own evaluation questions and indicators, remember to pick indicators that directly help you answer your evaluation questions. At this point, you have probably thought about and focused in on your evaluation questions on what you really want to learn. So in the same way, you need to keep your indicators focused on those evaluation questions. Evaluation questions typically need more than one indicator to fully answer them. So you must thoughtfully design your indicators to relate to the evaluation question. For example, if your evaluation question is, to what extent does the initiative reduce morbidity due to maternal mental health? You may have various indicators that's coming to your mind, each focused on different risk or protective factors. So you may have indicators focused on measuring change in mental health screenings, referrals to mental health services, and improved response to patients with identified suicide ideation. To try to find indicators that are really established in the field or implemented by similar work being done elsewhere. Many times for healthcare-related outcomes and measures, there are standard measures that are used. Agencies like CMS, Center for Medicare Services, HRSA, CDC, AHRQ, they have established measures that can be turned into strong indicators, especially as you're thinking about health outcomes. Also, there are questions, surveys, assessments that are standardized and should be leveraged instead of trying to come up with your own instrument or your own indicators. This will allow you to see how your findings compare to others, other sites, other initiatives that are done here in the States, here within your own region, or internationally. So this should be one of your first steps. See what is out there and build from there. Also, indicators should be SMART, in that indicator should only measure one element that is clearly defined. It should be measurable to see change, achievable in the time frame that is being considered, relevant to the evaluation question being answered, and time-bound to put some parameters in place for when the change should be happening. So let's walk through an example of an indicator, a SMART indicator. Let's say our indicator is percentage clinician attendees of the 2023 hypertension trainings who report high confidence in developing individualized hypertension care plans for pregnant patients immediately after the training. It's a mouthful, but it is SMART. This indicator is specific because it details who we are talking about and what we will measure. So it has percentage of clinicians reporting high confidence. This indicator is achievable because the intent of the training is to show clinicians how to develop hypertension care plans. And at the end of the training, clinicians should be able to start developing them. And since the training is designed for this, the indicator seems relevant, right? So however, we will have to double check if the indicator is actually aligning with the evaluation question. And if the question is something else, this may not be relevant, even though it may be SMART. So you have to double check that. And then finally, this indicator is time-bound because the indicator specifies that we're looking at attendees from 2023 trainings who report high confidence right after the clinicians are trained. So that was a lot of information on indicators. So let's do a practice. We built in activity where you guys can participate more actively and help us kind of build some indicators together. We will use Mentimeter for this activity and we'll appreciate everyone participating. So for this activity, I will share an indicator with you and then ask everyone if they think the indicator is either strong or weak. And we can provide your responses using Mentimeter. Haley is going to launch Mentimeter for us. You should see a pop-up on the top right corner of your Zoom screen that will ask you to allow the use of Mentimeter app. This will look like the black box shown on the screen. Click on join or open and you should see a new Mentimeter window with questions and answer options pop up. If you are not seeing the pop-up window, you can still participate by following the QR code or the numeric code that is included in the middle of the screen. And if you are using the pop-up, I think you can drag it around and make it bigger if you need. So let's go ahead and get started. If you're having issues, type it in the chat and Joy and Haley will help us troubleshoot. So for the evaluation question, okay, Laura's saying the code doesn't work. Haley, can you help Laura, please? Laura, did you try the code that shows up on the screen now? 21365865. Try that one. Thank you. So for the rest of you guys, the question that we have is, to what extent are the hypertension care plan activities functioning as intended? And the indicator we came up with was number and percentage of hospitals with 100% clinician attendance of the webinar training and over 90% of pregnant patients provided with an individualized care plan. So take a minute to respond with your answer. Perfect. Thanks, Laura. And Kiara, the question disappeared too quickly. I am going to see if I can paste the indicator. Okay, you see it again. Great. All right, so I'm gonna close it. Haley, can we close? And this is a trial. We have a few more, and I'm looking on the side because my Mentimeter is on the side. So don't feel like I'm ignoring you guys. So it seems like 13 of you said it was a weak indicator, and that is correct. This indicator is weak because it's measuring multiple elements at the same time. It's trying to measure both the number of hospitals with 100% clinician attends for training and that over 90% of pregnant patients have an individualized care plan at the same time. So a stronger way to build these indicators is to split them up into separate indicators. One that is just focused on number and percentage of hospitals with 100% clinician attendance of the webinar training, and number and percentage of hospitals with over 90% of pregnant patients provided with an individualized care plan as a completely separate indicator. So let's try one more. Let's do another one. All right, so this one, you have the same question. To what extent are hypertension care plan activities functioning as intended? And the indicator is sites adhering to care plan protocol. Is this a strong or a weak indicator? I'll give it a minute or two for folks to respond. Let's see. There's a few people still responding. All righty, let's try and close it. And the answer is it's a weak indicator. This indicator is not specific or very measurable. The indicator to be strengthened by specifying what is being measured and what adherence means. So an updated indicator could be number and percentage of sites adhering to care plan protocol as written. Next one. So for this one, same question, the indicator is number and percentage of patients filling prescriptions is strong or weak indicator. We'll give it a few more minutes. All right, Haley, can we go ahead and close? So majority of you guys said it is strong, and yes, it is a strong indicator, but you need to make sure that it's aligned with the evaluation question. This particular indicator is measuring if patients are filling their prescriptions. But if that is not part of your initiative, then it's not relevant, right? A more relevant indicator may be number and percentage of eligible patients with care plans developed. Because the purpose of the initiative and the question is to learn more about whether or not the hypertension care plans were implemented as designed. And prescription may be part of the care plan, but it's not the care plan itself. Next indicator. I think we have one or two more. Okay, for this one, now let's look at a different evaluation question altogether. So the question now is, what are the barriers to adhering to care plans? Do you think number and types of barriers to clinician adherence to care plans is a strong or a weak indicator? All right, let's see some responses coming in. All righty, Haley, can we close? Perfect. So yes, all of you said, most of you said it is strong. And yes, this indicator is strong because it is specific, it's measurable, and it is relevant to the question that we were asking. So now that we've covered what to look for in an indicator. Let's try to brainstorm some strong indicators for each of our evaluation questions together. So using the Mentimeter poll still on your side, you can now type in open space words, indicators that you think may be a good indicator to answer the question. To what extent are hypertension care plan activities functioning as intended? And if you remember some of the indicators we tested with, if you think those apply, then feel free to jot those down too. So now it's open text, so feel free to type in something. Patient outcomes, yep. Number and percentage of patients have care plans with goals completed. That's a good one. Others. Okay, percentage of patients being treated accordance to care plan. Documentation reflects hypertension plan of care. Percentage of eligible patients with care plans developed. What number and percentage of hospital units have enacted a policy? Okay, that's a good one. So what I will say is when you have statements like what number and percentage, you're now asking a question instead of writing it as an indicator. So I would suggest writing it as number and percentage of hospitals that have enacted a policy and take the what out of there. But these are really great suggestions. So let's move on to the next question. So a few indicators that we've come up with on our end for this particular question of the extent to hypertension care plan activities being implemented as intended. We have number of care plan training webinars hosted, number and percentage of sites adhering to the protocol as written, number of care plans developed by a site, and percentage of eligible patients with care plans developed. And we also have type of adjustments made to the care plan to fit the needs of the implementing sites, because if the care plan initiative is being implemented in multiple sites, you may have variances being adapted based on the unit or based on the site itself. So continuing to the next slide, this particular question is, what are the barriers to adhering to care plans? So what indicators do you think we can use to answer this question? And if you don't see this particular question, you may have a purple bar at the top that says skip ahead. Feel free to click on that and it'll bring you back to the question on the slide. Types of barriers, yep, that's a good one. Workforce staffing issues. And other types of barriers. So would you say workforce staffing issues is a type of barrier? Probably, right? So you want your indicators to be more broader, more higher level. So instead of making it so specific, I would just keep it to types of barriers, because you may have other barriers besides staffing. Percentage of patients who report their care plans reflect their goals. List the challenges, experiences to adhering to care plans. Types of barriers, chart of barriers. Yeah, perfect. So Haley, I think we can keep going. So what we have come up with for this particular question around barriers to adhering care plans is number and types of barriers to care plan adherence faced by clinicians as identified by clinicians themselves, and those that are identified by the implementers are noticing. And we also have number and types of barriers to care plan adherence faced by patients. You want to know if patients are adhering on their end too, right? So that could be another indicator. And see how these are more specific than just types of barriers. So we want that smartness of the indicators to kind of follow through in the barriers as well. Thank you so much. I think we have one more activity in a few minutes, but I really appreciate you guys participating and taking the time to respond to the questions. So we're going to go back to the slides for a few more slides, and then we'll continue a little bit of activity and build out the plan together. So thank you, Haley. So after we've decided what our indicators are, we want to determine how we are going to get the information for those indicators. So you may have heard of data sources. These are places, people, documents where the data or information comes from for those indicators. There may be more than one data source for a given indicator, but it's crucial to choose a data source that is most appropriate for the indicator that we are trying to answer for our evaluation question. So in general, data sources can be categorized into primary or secondary data sources. Primary data sources are sources of information that do not already exist, and you are getting the information directly from the source. For example, when you need feedback from participants or clinicians to tell you directly what they thought about the initiative, or what worked or didn't work from their perspective, you probably don't already have that information on hand from somewhere else. You probably need to hear it from them. So primary data sources often requires additional time and resources to collect the information. But the information you collect from primary data source is collected for the purpose of answering your questions. So you can tailor the questions and the approach to what is appropriate for this particular evaluation when you capture primary data source. Secondary data source, on the other hand, are information that is already available and collected for another purpose, a purpose that is not originally the evaluation. Secondary data sources can be internal data that are collected inside the organization. These could be attendance logs, notes from staff meetings, your visitor logs, something that's already part of the routine of the organization. They can be external data collected outside the organization. These are things that are collected by your partner organizations, your community partners, state health records, or the hospital association, for example. Secondary data sources will require less time and resources to collect the information because the information is already there. However, it's going to require more time for creating data sharing agreements with the owners of the information and also analyzing the data and understanding the data that's already available. You may also have to make sure that the information that's collected for another purpose is still answering the question that you want answered. And if it's not answering your evaluation questions, you may have to reconsider and go back to collecting primary data source yourself. So thinking about our hypertension example, let's see what data sources we may be able to use for the first set of indicators, which we're answering the question of whether the care plan activities are functioning as intended. So for the first indicator, number of care plan training webinars hosted, this could easily be identified by looking back at the program records in the PQC. You probably are already collecting this information and tracking who's attending the webinars, how many webinars are being done. The next indicator that's That's two indicators, actually. The number of care plans developed by site and percentage of eligible patients with care plans developed can be measured by looking at patient records. You want to see if how many patients have care plans on file. So you already know how to do it. You're going to look at the patient records. And then finally, the type of adjustments made to the care plan to fit the needs of the implementing site. You probably want to learn this by talking to the site leads and those on the ground implementing the initiative themselves, right? So you want to talk to the site leads, probably. Now, what data sources can we use to measure the indicators for the second evaluation question? What are the barriers to adhering care plans? So for the indicators of number and type of barriers to clinician adherence identified by clinicians, the best source is going to be talking to the clinicians themselves. The second indicator where we want to look at barriers to clinician adherence, but by the implementer's perspective. So the data source is probably going to be your implementers. So say you have site leads at each site and talk to them. They're going to be able to tell you what they're noticing is happening for their site. And then finally, number and types of barriers to patient adherence to care plans. Again, the best bet is going to be your patients themselves to tell you what's working, what's not working for them. But thinking about how challenging it is to collect anything from our patients and the data processes that we have to go through as an organization, it's probably going to be easier to talk to your clinicians and have the clinicians share more about the barriers their patients are facing, have clinicians reflect on their engagement with the patients and what they're observing and discussing with their patients. So while data sources are referring to where the information is coming from, data collection methods are how you will gather that information. So for example, if your data source is a group of clinicians, your data collection method could be you can survey them, you can do interviews one-on-one with them, you can bring a couple of clinicians together and do a focus group, or you can just sit in and do some observations. There are lots of options. So which one do we pick? So let's talk about different data collection methods real quick. So earlier we talked about indicators being either quantitative or qualitative. Quantitative are number-based and qualitative are textual. Examples of quantitative data collection methods are surveys, tests such as clinical tests or psychological tests. I still think about my SATs and GREs. Your administrative data logs such as registrations, attending training lists, or your observations of things and places. These are all quantitative. Qualitative, on the other hand, are surveys again, because you can add open-ended questions in the survey to capture qualitative textual information. Then you also have one-on-one interviews, focus groups, observations, and document reviews. So these are common methods that are used for evaluation. There is no one best way to collect data to answer your questions, but we highly recommend you using multiple data collection methods whenever it's possible and appropriate. Answering your evaluation questions often requires you to consider multiple viewpoints, perspectives, and needs. And you can achieve this by collecting evaluation data from different data sources and methods. So the mixed methods approach to evaluation uses both quantitative and qualitative data. By choosing a mixture of the methods, the impact of each method and its disadvantages are minimized. So for example, if you're trying to understand if participants are satisfied with your trainings, you can look at whether they attended the training first, and then you can give a survey out to them and say, on a scale of 1 to 5, tell me how satisfied you are with your training. These are going to be a quantitative data. But this approach is only giving you information on, how did they like the training? If they said 1 to say that they were dissatisfied with the training, you're not getting anything else to help you. You're not getting information on why they didn't like the training. So you will need more contacts, either from the participants themselves or the facilitators of the training. By capturing information from different places and people, you can put together a complete picture of what's really going on and how best to improve the training. So in our example, adding an open-ended question in a survey and talking with facilitators, you'll hear why participants were not satisfied and what did the trainers observe. That may give us a little bit more context as to what can we do to improve the experience and the training for the future cohorts of participants. So this gives us a complete picture by talking to different people and getting different perspectives. So now, going back to Mentimeter, if you didn't close your Mentimeter, it may still be open on the right side. And if you did close it, you should have another pop-up window like before that Haley's going to push out. And then for those who logged in using the code, use the code that is on the screen right now, which is 27708698. All right, so with this activity, we'll build out our data collection methods for the indicators that we identified and then see how we can answer our evaluation questions. So let's build out the first question. Again, Mentimeter has the space where you can answer the information. And I'm trying to fix my Mentimeter at the same time. Right. Is everyone good? Are we typing responses to data collection methods that will help us measure the indicators for the first question around seeing if the care plans are implemented as intended? So attendance logs, yes. That would be a type of program records, right? What about patient records? How do we think we can capture information on the patient records? Chart reviews, yeah, exactly. Quantitative methods, review of records, chart review, audits, yep. What about site leads? How do you think we should get information from the site leads? Should we do surveys, interviews? How should we do that? EHR extraction, yep. Review program records. You guys are right on. Surveys, internal records to see number of webinars hosted, interview site leads, interviews with charge nurses, yeah. These are great. Any more? Give it a second. Okay, we can go to the next slide, Haley. So you guys were spot on. We came up with very similar responses to you guys. So for the first indicator, number of care plan training webinars hosted, we chose to look at program records, and we thought the best data collection method would be document review of webinar records and internal documents to see how many webinars were held and who was attending. For the next two indicators, with patient records, we also thought an audit of the patient files to check the individualized care plans was a good idea. And then for the final indicator, with types of adjustments made to care plan, we decided to talk to site leads as our data source, and we thought that it would be good to do virtual interviews with them using a semi-structured interview guide. You can also do surveys. We just thought interviews would be better because it may give us a little bit more open space to interact with them and get more context into what exactly is happening on the ground. So for the next evaluation question, again, what data collection methods best fit for capturing barriers? So if we're talking to clinicians, how do you think we should go about engaging our clinicians? Interviews, unit surveys, yep. These are good, and I'm just going to keep us going, looking at time. I want to make sure we have time for questions too. But yes, no, surveys with clinician open-ended information is really spot on. You really do want some qualitative data that gives you a little bit more context to what's happening. So looking at what we came up with, we thought it would be best to do a clinician survey. And that would the survey would capture both the number and types of barriers and the number and types of barriers by patients. So hearing from clinicians from their perspective and also what they're seeing patients are having struggles with. And then for the site leads, because the earlier indicators also had virtual interviews, you want to make sure that you don't keep interviewing the site lead. So in the same interview, you can probably ask about barriers that they're noticing as well. Great. Thank you so much again for participating. I think that wraps up the Mentimeter portion of the slides, and I can't thank you enough for playing with us and participating in the interactiveness. I know Haley's been working really hard on those, so we'll go back to the slides. And Haley, if you would go back to presentation mode, please. While Haley's pulling up the slides, now that we know which indicators we're going to use, which data sources we're going to use, and which methods we're going to use to capture information, it's time to start developing a data collection plan. And you'll specify who will collect the data, how, and as well as which frequency will the information will be collected in. And I see Haley's trying to troubleshoot, so we'll give her a second. And if not, Haley, I am happy to take yours.
Yeah, if you could take over, Tanya, that would be great.
Yep, I can do that. Let's see. Do you guys see anything? Do you guys see my screen now?
Yep.
Awesome, great. So data collection plans is what we will be doing now. So you want to specify who will collect the data and how. You will want to think about the frequency in which the data will be collected, and then you would want to decide who will manage the data, who will have access to the information, and how data from each source will be secured and stored safely so that any identifying information is securely saved, either deleted or not available to those who don't really need access to it. And then finally, you'll develop a data analysis plan that describes how you will analyze data from each data collection method, including who will be responsible for analysis and how often the analysis will take place. So we do have examples of what these tables may look like. So if you're building a data collection plan, for example, you will have something like for our document review, the PQC data manager will be responsible to get access to internal documents and review every 3 months to note when and how webinars took place. So for each data collection method that we've decided on, we'll fill out this type of information. In the data management plan, it's very similar. You have to talk about who's going to be responsible for managing the data, where is the data going to come from, how data and the confidential information will be kept secured and protected. And this should happen for each of the data collection methods, but there are other templates out there for data management. So if your organization already has a template that you have to use, feel free to use that. If you don't, then a simple table like this should also suffice. And in here, for example, for the audit one, you can just say site lead is going to share de-identified information as in Excel, and the PQC data manager will be responsible for keeping the file secured and password protected so that no one else has access to it. And then finally, similar table for the data analysis plan. For each data collection method, you'll just fill out what exactly are you thinking about analyzing, who's going to be doing that, and how often are you going to analyze the information. Once you have decided your evaluation methods, your data management and analysis plan, you can start implementing those plans. And once you implement those plans, what you're going to do is you're going to gather evidence, which is the third step of evaluation. And then after that, we'll summarize all the rich information that we're collecting and then identify ways to use the findings in practice. And so webinar 4, which will be next month, will focus solely on summarizing and using findings in practice. Quick reminder that we will continue to have office hours for CDC-funded PQCs, with the next office hours scheduled for May 7th. And we're happy to talk through indicators, data collection methods, data analysis plans, data management plans, anything that is specific to your PQC in more detail during that time. Joy's going to put the link to our website one more time. There you can find all of the registration links and the schedule and recordings from these webinars as well. And with that, I would like to thank you all for participating and joining us for this webinar. We will transition to questions, but before I do that, just a plug for evaluation. There will be a quick survey at the end of the webinar, and I would really appreciate you guys taking a second to fill that out. We do want to hear what type of future webinars you want. I know we're just doing 101 level right now, but there are several data staff members here, so feel free to tell us in detail what type of support do you guys need, and we're happy to build future webinars that are more tailored to your needs. So I am going to stop there and pass it on to Haley to kind of help me filter some questions and answers at this point. And then if you guys have to hop off, I know we only have a few more minutes left, but we're happy to stay longer. If you have to hop off, you can email us at maternalhealthtTA@cdcfoundation.org, and we'll respond to your questions there too. So I am going to stop talking.
Yep, it doesn't look like any questions came in during the presentation, but as Tana said, if anything comes up to you now to ask, please feel free to ask in the chat or Q&A, or raise your hand if you want to be on.
Yeah. I hope this was helpful for you guys, and again, thank you for participating in the Mentimeter with us. Thank you, Lori. Thanks, Audra. Does anyone have questions? Was this helpful? Did you guys need anything in more detail? Thank you. Feel free to raise your hands if you have questions, and it's a small group now, so we may be able to answer it live. And if not, thank you for attending and hope to see you in a couple of weeks in the next webinar or the office hour.